At the University of Chester, we have dedicated clinical skills and simulation spaces at each of our campuses. The purpose behind these facilities is to simulate real-life scenarios so that you can practice clinical skills and procedures in a safe environment. Our facilities help you to gain confidence and competence before working directly with patients in real clinical settings.
Our medicine, nursing and allied health and social care degrees at Chester use these facilities to help you acquire the essential clinical skills specified by regulatory bodies which you will need for the future. Our clinical skills training areas are where you perform and practice procedures and perfect your skills. Part-task trainers are used in these areas as they have a realistic feel and are anatomically correct. This helps you learn and practice specified skills before performing these skills on real patients.
Touchscreen monitors use digital technology to enhance understanding of practical tasks. You can access resources such as clinicalskills.net and complete anatomy software to follow procedures taught by facilitators, learn with peers and explore specific anatomy and physiology related to the skill you are learning in the clinical skills training area.
Our Microsoft HoloLens headset overlays a hologram of internal anatomy onto our computerized patient simulators, where you can view the internal changes that occur during common clinical situations and emergencies. You will be able to see what's happening both inside and outside the body, and will develop an understanding of what occurs if a skill is not performed correctly.
Alongside the clinical skills training areas are our simulation spaces. Here you will learn and practice more complex skills and encounter common clinical situations in a simulated environment that echoes real-life clinical settings. All simulation spaces are designed to replicate hospital and non-acute or home environments, with the idea of being as immersive as possible.
You'll follow the patient journey from the community to admission, with escalation or de-escalation of care to more acute clinical areas, such as our dedicated critical care areas. We reflect the real-life environment of children's, maternity and general adult wards, mental health inpatient areas, critical care units and areas that emulate emergency departments.
Our non-acute or home simulation areas have everything that you would expect to find in either a person's home or a residential facility. We involve trained service users and actors alongside patient simulators to enable you to develop your clinical skills around the process of breaking bad news or having difficult conversations. Cameras record encounters so that you can watch these as part of our debriefs to improve your future practice.
Interprofessional learning opportunities are abundant in our clinical skills and simulation spaces. Students from across our medical and health-related courses all use these areas, so you will experience a multidisciplinary team's input, just like in real life.
You will graduate already having experience in a multidisciplinary team, and your communication, resource management, decision-making and clinical reasoning skills will be enhanced greatly with the fantastic simulation spaces here at Chester.